Hi y'all, I'm Ashley and this is my first YouTube video. On this channel, I'll be giving pet owners like yourselves advice, tips, tricks, and just kind of a little insight behind the scenes when you take your pet to the vet and even when you make that first phone call to come see us. I wanted to create this channel because it can be really overwhelming as a pet owner, the amount of information that's out there on how to just basically take care of your pet. There's Dr. Google and Facebook, your breeder, your cousin's friend's uncle, but the truth is you should only be getting your advice from a veterinary professional, and that's where I come in. I'm an LVT, short for licensed veterinary technician, meaning I went to school for 2 years under supervision from veterinarians. After 2 years and my externship, I was cleared to take the state exam and then the veterinary technician national exam, or the VT&E super scary exam. But after passing, the state gave me my license and I've been practicing ever since. I've been in practice for 7 years. I have experience with all species, but my expertise is with small animals, so dogs and cats, hence the channel. I've worked in a small rural hospital. I've worked in a huge 6-doctor practice in the middle of the city, both in private and corporate settings. So I kind of know my stuff. I also have small experience in ER medicine and shelter medicine through the relief service that I work for, so I like to keep myself challenged and pick up those extra shifts when I'm not feeling too burnt out. But for the most part, my expertise is in small animal preventative medicine, so that's what led me here today to help all of you. So for my first topic, I just kind of wanted to talk to you guys about what we've been dealing with during this whole pandemic thing. Everybody got a puppy or adopted a pet or found an animal on the street during the pandemic, which is great. It's awesome. It's great that everybody decided to take in a pet during this difficult time. But we never stopped at the vet clinic. We got so busy. We're still busy. So please don't call us the day that you want to be seen and expect to be seen. Because again, we are so busy. We're expected to see 18 to 19 pets per doctor per day. That's like 45-ish pets. And we book out fast. And those doctors not only have to see the sick pets or the healthy pets, they also have surgeries that they need to complete before they even see other patients. And then myself, I have my own appointments. I'm going to see your puppy. I'm going to give your puppy its boosters. I'm going to see your anal gland expression, your surgery recheck, all of that. So I myself am busy as well. So please don't call us the day that Fluffy needs to be seen because she's been scratching her ears for 4 days and you're done with it. And today's the day you have to be seen because we're most likely not going to be able to get you in. While we do have triage times, triage is reserved for the rare emergencies that will ultimately walk in through the door. And I mean, we handle emergencies, but we're just as a preventative care facility not really equipped to handle the big ones. And that kind of segues me into my next topic, ER versus preventative care. ER is emergency room, like life-threatening, go now. Whereas preventative medicine, we're going to see your coughing pet, your scratching pet, and then we're also going to give your little puppy and your little kitten vaccines, and we're going to spay and neuter your pet, or we're going to do things like dental cleanings. Do not bother the ER with your ear infection, please. I'm advocating for all my ER vet techs out there. They have more critical cases to see than Fluffy's ear infection. We will see Fluffy. Maybe not today. Maybe we can't fit you in tomorrow, but we will see Fluffy for her itchy ears. We know she's uncomfortable and we want to help her, but the ER has bigger fish to fry. That kind of segues into when do you go to the ER? You'll know when to go to the ER. If you ever have any doubt, call us. We'll let you know when to go to the ER. Things like GDV, where the stomach has flipped over itself. That's a big one to go to the ER for. You'll notice abdominal discomfort, vomiting, diarrhea, extreme lethargy. If your pet has ingested anything, I don't care if it's, I don't know, grapes, I don't care if it's garlic, I don't care if it's your weed, call us and let us know what your pet ate, and we'll let you know if you can come to see us real quick for an emergency, or if it's more serious and you need to go to the ER. Pets ingesting anything that isn't specified for a dog, like, just call us. We'll figure it out for you. We'll let you know where you need to go. Also, don't call us upset when we do refer you to the ER. We're referring you to the ER because that's in the best interest of your pet. It's not because we don't want to see your pet. We want your pet healthy and to survive. So that's why we're ultimately telling you to go to the ER. Again, we do handle some emergencies, but as a preventative care facility, we're not equipped for the big stuff. We're not equipped for overnight monitoring and the big diagnostic tests. Like, we got blood work and an x-ray. Like, emergencies require more than blood work and an x-ray, and it's ultimately in the best interest for your pet to go see those ER technicians, those ER doctors. Because our doctors, while they're great, while they're educated, they are not used to those big, scary emergencies. I worked with doctors that have, but again, on the facility that I did work in with those doctors that did have those knowledge, there was no overnight monitoring. So that's a whole nother topic in itself. Anyway, so I'm clearly rambling, but yeah, that's just kind of my topic today. I'm going to be covering so many topics on this channel. Really excited for breed breakdown for you big breed people out there. I'm going to break down some of the most popular breeds, breed disposition, all that kind of thing. I'm also going to really hit hard on nutrition. During the pandemic, I felt like that was a big focus for me to get my continuing education hours in nutrition, because there's so much pet nutrition advice out there. So we're going to be hitting that hard. Just basic pet care, parasite prevention, heartworm disease. Also, if you guys have any questions, any topics you want me to cover, just kind of drop a comment, like and subscribe my channel. I was very nervous for this video, but I'll be back next week with another video. Ta-ta!